Hi, this is Jessica DaMassa with WTF Health. I am here at the Bayer G4A Accelerator launch in New York City. And joining me right now, I have Scott Cousino. He is the founder and CEO of myStrength, which is an application that helps with comorbid mental health issues. So talk to me a little bit about this, because we were talking about what makes the solution so different in a really crowded space. And so what's your differentiator?
Yeah, it's a great question. So what we focus on is really the range of behavioral health conditions. We focus on anxiety, stress, depression, substance use disorder, chronic pain, and sleep. And why we do that is oftentimes consumers will have those conditions simultaneously.
Sure.
And what really exists in the marketplace right now, as we see it, is an individual app for depression or an individual app for sleep. But it really doesn't address the consumer needs when those situations co-occur. The other reason is we work with payers and providers. We're working with some of the largest health plans and health systems in the country, and they really want one solution as compared to individual point solutions. And so that's probably the most significant differentiator. On top of that, we also introduce very tailored wellness content and user-defined spiritual or inspirational content to really focus on the holistic side of well-being.
That's awesome. So yeah, I mean, I think what you're saying is very true. It's a trend that we're kind of tracking, is that the point solution is starting to go away, and that especially these larger organizations are looking for something that has a whole system or a platform that can be applied that addresses multiple things.
Exactly.
Right?
And integrates well into clinical workflow and other resources that they're offering.
So talk a little bit about that. How do you guys integrate into the clinical workflow? Because that is another thing too. It's like you don't want all of this great data that's coming in just sitting there isolated in an application.
That's a great question. So we have trained about 20,000 clinicians on myStrength. myStrength has two fundamental use cases. The first is as a self-management resource.
Sure, and that's for the patient, right?
Exactly.
Okay.
The second is a treatment extender for the clinicians.
Okay.
The unfortunate reality is half the counties in the U.S. don't have a practicing mental health professional. And so technology can really elevate up access. And so what we do is we train the clinicians on myStrength to offer that resource up in between sessions, to complement interventions when they're taking place, to outreach to rural consumers. And so one is just the process of training and getting them very comfortable. The second is we do a lot of technical integration. Okay. So we integrate into care management platforms and integrate into electronic health records.
How? Like, what do you guys pull in?
So it's actually bi-directional. Okay. So we're pulling in information on the consumer to make it incredibly easy for the consumer to enter into our platform, and then we're sending information like mood tracking, how they're using the platform, any alerts back into the care management or the electronic health record as well. So it's a bi-directional
So
flow.
is there like a preventative aspect to this then from a clinician who's watching this? Are they alerted when something's going awry?
There is. In fact, we just launched most recently a clinician dashboard that has a whole set of tracking capabilities that includes alerts. So if a consumer is starting to move in a downward trend with their mood tracker, there's actually an alert that will go back to the clinician if they're interacting with the platform.
So I want to pick your brain a little bit, because you know, we talk a lot about digital health applications, and I think like the shiny newness has gone away from a few years ago, and now the rubber's starting to meet the road.
Yeah.
And so you guys have, you told me 140 different companies that you're working with, and some of these are big health plans. Like, how do you feel like you've tackled this in a different way that has given you kind of like this more systemic view, I guess, or this ability to integrate? What do you feel like you're doing differently?
Well, I think first and foremost, we're producing data. I think our traction is really fueled by a whole range of outcomes that we've been able to demonstrate, from a high degree of engagement. I think one of the Achilles heels in the space is it's not an if you build it, they will come. And oftentimes there's very poor retention of engagement. And we've been able to demonstrate very, very strong ongoing utilization of myStrength. Folks coming on 8 times in the first 45 days and spending 12 minutes interacting with the platform. Secondly, we've demonstrated very significant clinical improvement, and we've demonstrated that in randomized control trials and real-world studies. And then most recently, we did a 2-year claims-based study to demonstrate a significant reduction in overall healthcare costs. So I think the age of kind of if you build it, they will come, and the shininess is wearing off. And I think there's a tremendous amount of of focus on are these tools producing value?
Yeah, and it sounds like you've demonstrated yes.
And I believe we have, which is, as I said, really fueled the growth of the company.
That's awesome. So last question for you. What are you most excited about, I guess, as this space continues to evolve? Because like we just said, 2 years ago, digital health applications, it was like there's one for everything. And now things are starting to kind of, collapse a little bit. And so there's like some bigger ones that tackle multiple problems. So what do you think is next?
Boy, I think there's a lot. I think in the space that we operate in, mental health, I think we're still in the nascent phases of really understanding how platforms and tools like myStrength can continue to emerge. I think artificial intelligence, machine learning, clearly beyond the buzz, I think can really help to create more preemptive and proactive mechanisms to get tools and resources to consumers as they're starting to struggle. And I think that's one of the areas that we're most excited about. In addition, we're very focused on maternal mental health as kind of one of our next areas of focus, and then youth. As a father of younger children and seeing the consumption of technology, but we also see correspondingly and unfortunately a high degree of mental health related issues. Youth for us is a big focus.
Awesome. Well, thank you so much for joining us. It's a pleasure to learn about you. If anybody wants to find out more, what's the myStrength website that they can check out?
myStrength.com, www.mystrength.com.
Awesome. Well, thank you so much. I'm Jessica DaMassa with WTF Health.